The greatest challenge is the silence that surrounds infertility in America.
Do people talk about this? Is this something I'm just supposed to journal about? Am I just supposed to talk to my husband?
You kind of felt awkward sharing the story with them because you would say, oh, congratulations on your child, and then they'd say, well, what about you? And when are you gonna have a child? And the response is, well, we've been trying for 5 years and we had a miscarriage.
This is just a fundamental biological process that I should be able to do. What could I have done differently throughout my life to have changed the outcome of this?
This is not something that they should feel they brought onto themselves. This should not be something that they feel makes them less of a man, less of a woman, but really something that's a health issue.
We always talked about having a family. After about 6 months of trying, we started to wonder.
We kind of knew or suspected that there may be some issues. We started to think, okay, maybe it's time to start looking into what the options are, where we can go from here.
It was very taboo. I didn't really know who to talk to.
Isolation happens when conversations are not happening, when you feel it's your problem and not others' problem. So there are misconceptions about patients coming in, and they're completely emotionally and psychologically derailed by the conversation. I want them to know the breadth of possible interventions available.
There was a lot of different thoughts going through our head. It was overwhelming at first. We didn't know what IVF was, we didn't know what it meant.
What IVF is, in the most fundamental sense, is being able to have fertilization, egg and sperm meeting, happening outside the body. What happens is, instead of taking one egg that a woman naturally produces in a given month, we coax many eggs to grow in that same month. And that's a way to have multiple embryos from a single IVF cycle.
We made it all the way through to the egg retrieval. A few days later, I was experiencing excruciating pain. They conducted a laparoscopic surgery and found that I had ovarian torsion. My ovary had rolled during the egg retrieval, which is a very, very rare thing to happen.
Not only did she have torsion, which was completely corrected, but one of the things which I had not expected, because she had no symptoms whatsoever, was endometriosis.
Endometriosis causes scarring within the fallopian tubes. The fallopian tubes are really the road that connects egg to sperm. For some patients, they'll have endometriosis and really seem relatively asymptomatic, with the exception of the fertility difficulty that they're facing.
For me, finding out that endometriosis was a part of what was preventing us from having a successful pregnancy was a little bit of a relief. We may have an answer and there's treatments for it. Then we had another round of IVF, and we found out we were pregnant. We were happy, we were confident, we told our family, we started to tell some friends, and that was at week 12. At week 13, I went back for another follow-up appointment with my OB, and that's when we found out there was a serious problem. And I don't really remember a lot of it, as it was a huge blur at that point. That was...
They ended up losing the pregnancy.
And I wasn't sure if I was going to be ready to do it again.
People who are already perhaps facing an emotional toil of facing the infertility battle, when they feel like they have a minor victory by getting pregnant and then it ends in a miscarriage, it can be exceptionally heartbreaking.
Getting those results from that pregnancy told us that we needed to do genetic screening of future embryos. That gave me hope again.
Keeping in perspective these findings gave me an opportunity to think beyond textbook, really individualize the management as data appeared.
And we had another successful pregnancy right away. And that's what brought us to today, where we have Audrey.
It's unbelievable. With being a parent, having a little girl now, and coming home from work every day, no matter how difficult of a day, seeing her, it changes everything.
It kind of brought me to this point of, okay, the baby's here. Well, wait, now what? Totally shifting gears in the way of thinking about family, because it was all about how do I create the family, but now with the family here. My message to other couples out there who are going through infertility is, you're not alone.
You can't predict what life has in store for you. There is hope. There's always hope.
Don't give up. Don't ever give up. Stay positive.
So many people walk through this, and they walk through it alone for all of those challenging reasons of stigma, of shame or guilt. And to know that they're not alone, and to have that dialogue may be the thing that allows them to come into care and receive just that one extra bit of effort that helps them towards that goal. And maybe we at Yale Fertility Center can be a part of that.